Hello and welcome to the Sleep Matters podcast from Dreams. Everything you need to know about how to have a good night's sleep and why it matters so much. In today's episode, we're focusing on winter sleep. And I'm delighted to be joined by Dr. Khaled Sadek. Khaled is a GP like myself, but he's also pioneered some novel research into deciphering the role of sleep and our health and disease. And I'm thrilled to be joined by a fellow Irish lady from Derry, and this is Caroline McMenamin. And Caroline's a mental health therapist, and she's someone who personally suffers from SAD, which we know as seasonal affective disorder. So I always like to ask this question. How'd you sleep last night, Khaled?
I slept really well, thank you.
Yeah. Smug. How did you sleep last night?
I was up really early, like 3:30.
Oh, right,
alarm.
okay. So you're
ironic, eh?
Going to nod off in the middle of this. How does our sleep and why does our sleep change in the winter time?
It's a very good question. What we've got to remember is that sleep plays a pivotal role in life throughout planet Earth. It's evolved to live within a 12-hour, 12-day cycle. So everything from plants to animals to humans have adapted evolutionarily to this process. And what that means is that a lot of our basic physiological processes are now synchronized to whether it's day or light in the environment. For instance, blood pressure, we know that it has a circadian rhythm throughout the day. Even our social interactions have a circadian rhythm throughout the day. And when you start to change the periodicity, the time in which you have daylight hours and night hours, that's when the body starts to get a little bit confused. And as we enter the darker seasons from autumn to winter, you get that photoperiodicity, a little bit of a shift there where the light is a little bit less available and the dark hours a little bit more frequent. And that invariably has an effect on our bodies, which will translate into abnormal sleep.
So for you, because I sometimes, you think it's like 3:30 and it's getting dark. How does this seasonal change affect you?
I can almost, feel it in my mood first and foremost. And then around, even by the time 5 o'clock hits, I can feel a spike in my anxiety and a drop in my mood. And then I'm just done socialising for the day. I have my winter self and I have my summer self. It's kind of like Jekyll and Hyde, and I'm just almost a fraction of the person I am in winter than I am in summer.
So when do you sort of take to bed in the winter time?
I'm probably more in bed than I am awake, but I do a lot of work because I work for myself and I would do work from home, so any opportunity to sit in my bed and work, I'm doing it. It's obviously not a healthy relationship to have, but I think by the time 6:30 hits, I'm almost looking at my clock going, is it bedtime yet? Because the energy is just drained from me. And you start to crave more and more carbs and you don't want to be eating anymore.
Yeah.
And I just kind of feel like then all my motivation is gone for the day and I don't even have the motivation or enthusiasm to watch the TV.
So Khaled, what's going on here?
Yeah.
Because clearly the darkness has a profound effect on you. What's going on in terms, because that carbs thing is a big thing that we hear that a lot, and this, I want to be antisocial, I want to hibernate, I want to go in a hole and come back out in March.
Yeah, what Caroline is describing to us are almost cardinal symptoms of seasonal affective disorder. Now this is not just low mood, a lot of depressed people have that depression, but what makes seasonal affective disorder so very different is that one, it's relapsing, remitting. It comes up in the winter months, as you've described, but it's also got these atypical features, features that we don't typically see in mental health disorders and depression, such as carb craving, hypersomnia, that means sleeping too much, that hibernation, the fatigue and the inability to socialize, lack of the motivation. So these are features that are very unique to seasonal affective disorder. And that's what Caroline here is describing to us.
Yeah, because I suppose classically a person who has depression they don't want to eat really very often and they just don't sleep. So it is like the animals. So should we be hibernating? I suppose we can't hibernate. The life has to go on. But, are we programmed to say that we should be hibernating or we should be doing the 12 hours on, 12 hours off?
It's a very good question. There are a lot of environmental stimulus that will change our sleep behavior. And one of them is temperature. We know that if it's too hot, remember in the summer, not too long ago, you wouldn't think so with the weather outside today, but when it was really hot in the middle of July, we all struggled to sleep. We wanted our air conditioning on that we never had, and we couldn't tolerate the duvet. So if the temperature is too hot, you won't actually get to sleep very well. But conversely, if the temperature drops significantly, your body automatically will want to initiate sleep. That'll increase your sleep pressure and make you want to sleep. Not necessarily hibernate like a little tortoise, but you'll certainly get increased sleep as well. And with the increase in the night hours, what you're physiologically getting is your brain is sort of picking up that it's dark. Your brain is sending special sleep hormones around your body that is inducing you to sleep.
So wintertime, I mean, have we got sort of evidence to suggest that people really do sleep more in winter?
We don't have hardcore randomized controlled studies on sleep duration, which is seasonal. But what we do know is from large cohort studies that involve people sort of telling us how they're feeling. So it's very much a subjective feeling questionnaire, retrospective. They go back and they tell us how they're feeling. They certainly do give us these pictures. And when we put that into the context of what we know sort of on a biological level, because obviously sleep has been very, very important for many, many years, not just more recently. But what we've always struggled with is to understand the sort of the mechanism underneath it. Why is it that our body is responding the way it does to certain cues like light and temperature? And so we've gone a little bit deeper, we've identified how that works, and hopefully we can translate that into the symptoms that Caroline is describing to us.
So is Caroline, I mean, who are the people who you might think are the classic people who will get this seasonal affective disorder?
Yeah. Well, sleep actually, if you look at it as a whole, it plays a big part in a lot of mental health conditions, not just seasonal affective disorder. So people who suffer from depression, as we know as GPs, they always tell us, look, I struggle to get to sleep, and then I wake up at 4 o'clock in the morning. So early morning wakening is a red flag when it comes to mental health assessment. So the sleep role is important in all mental health, but it seems to be playing a much more clinical and much more diagnostic role in seasonal affective disorder, in that we are using the sleep as a form of diagnosis, while the other sort of mental health conditions, we are using mostly sort of mood feedback scores as opposed to actually objectively looking at sleep. We often ask our patients, what's your sleep like? Are you sleeping well? But what does it mean to us clinically? And for most GPs, it wouldn't be a huge amount of information. But with more knowledge around sleep and the way that our body responds to sleep, we'll be able to actually put that information to much better use and be able to treat our patients.
So for Caroline, and indeed the rest of us who are, feel like we're going to work in the dark, coming home in the dark, we're like little moles in the wintertime, how can we wake up feeling refreshed? I mean, what do you do? What's your strategy, I guess, first of all, because you're living with this?
Yeah, I live with it, and I think because if you already have like a predisposing factor like mental health issues, for example, I live with OCD, I'm more obviously predisposed to experiencing it. But as a therapist myself, I actually run workshops around Ireland called Beating the Winter Blues. And the things that are very important are food, good mood food, and nutrition. The gut-mind connection is vital. Vitamin D by a supplement, because you're not getting it because we're in the Northern Hemisphere and we are getting a lack of light. So a lot of it's the motivation, how we can motivate ourselves, the vitamin D supplement, looking at magnesium if you're like lacking in your diet, which a lot of people are, and getting out and about and kind of breaking that resistance of wanting to stay back home, because I'm antisocial at the best of times anyway, so I don't need to be any more antisocial. So it's about pushing yourself and realizing that the idea of it is so much worse than the reality of it. So I say to people, don't think about doing something until you're actually doing it, because the idea of it is so much different than the reality of it. The idea of going to the gym is so much worse than actually being at the gym, and that's the message I try to get across.
So do you have to be quite strict on yourself though when it gets dark?
Discipline. A lot of discipline, but it pays off. The more you discipline, the more you appreciate then, like the good lying on, or knowing that you had a really productive week because you were at least a bit regimented. And in the long term too, you know it's beneficial for your mental health, because if it's already precarious, then you don't want to go back and relapse, especially around Christmas when there is extra stress, financial, relationship, everything else that comes with Christmas.
That's the problem, I suppose. This is at a really bad time, isn't
Yeah.
it? You've got that big season, everyone's delighted with themselves and you're exhausted, you don't want to be out, you want to be antisocial. I guess there are a lot of carbs on offer at Christmas, but apart from that, it's hard, isn't
And
it?
the obligation to drink alcohol too is a big factor, weighing heavy on a lot of people, especially with people who are not yet at a place where they're vocal about their mental health. Alcohol is still alcohol is the only drug in society that we get shamed for not taking it.
Yeah. Gosh, how do you, in your patients who come in and say they think they have SAD, how do you deal with them, or what advice do you give them?
I think that's a really good question, Bixie. Because 20 years ago, if someone came into my clinic and said, "Oh, doc, I feel pretty low, put on loads of weight, I don't like the dark," there wouldn't have been a huge amount I could offer him.
Yeah.
Apart from, sorry.
Yeah. Sorry, none of us like the winter.
Yeah, none of us like the winter. Got to ease up on the mince pies. But at least now we've recognised these particular traits. So the first step in medicine is to be able to identify the traits, clump them together and associate them with a disease. Once we do that, we can then educate ourselves, make the doctors more aware of this condition, so that when patients come in, we don't say, just ease up on the mince pies. We say, actually, you know what, Caroline, I think you've got this, and you should know about this, because once the patient is empowered to know what they've got isn't just them being lazy or depressed, that it's actually a condition, it's at that point that I feel like the patients really do feel empowered, and they can go about and make changes to their lifestyle to bring, like you've done, Caroline, it was amazing, to turn things around so that every winter it doesn't just become a 15 kilo weight gain and in bed, and then come spring, it's a rush to get that beach bod in time, and being able to recognize it, being able to put the preventions in place. And I think really it's our fault as doctors for not being able to recognize these conditions early enough in a lot of our patients. So podcasts like this will be able to get the word out, spread the word that seasonal affective disorder, it's real, we should be able to recognize it, and we should be able to treat it.
So what's your feeling on light boxes?
You know what, there's a lot of work on light in general, around seasonal affective disorder, but a lot around resynchronization therapy and as a whole, not just for mood, but also for other issues. There's actually been a lot of work, and it's been very, very positive. The biology behind it is that your eyes are really the window into the soul, It's light entering the back of your retina that's picked up by the grandfather clock in your brain, known as the suprachiasmatic nucleus. And that clock really generates the circadian rhythm that lets you know when to sleep, lets you know when to wake up, and then you can get on with the rest of your day. By reprogramming that SCN, that suprachiasmatic nucleus, using something like bright light therapy in the form of a light box or a visor, you're kind of almost tricking the brain into thinking, actually, the light hours are a little bit longer than they should be, pushing back some of the genetics that's kind of making your body feel the way it is, boosting some of those natural good hormones, those neurotransmitters, the serotonins, those adrenergics that make you feel good about yourself, and then giving the patient a really nice way of feeling better without having to take a tablet.
And I suppose ultimately, if you've got your light box, it's not going to do any harm, is it?
You know what? The side effects are very, very rare, and there are very small number of contraindications, like if you've got some, rather catastrophic eye disease. But often, I think some patients do complain of a bit of nausea, a bit of a light headache, eye soreness, but very well tolerated, very simple, and very, very effective and very quick. Patients seem results within a week compared to, our antidepressants, which can take up to 6 to 8 weeks to really kick in.
Yeah. And I suppose we've got the big light box in the sky, getting out in the day and soaking up some of that bright light, on days is.
Yeah.
But if you have the luxury of being able to go out in it, have you used anything like that, or do you?
I don't. I try to get outside as much as I can.
Yeah.
As when it's at the brightest point, and then I go a good walk, and that way then I'm not only getting as much vitamin D I'm also getting exercise, which then kind of makes me feel better mood-wise, and then I would do a bit of yoga. So I think exercise and getting out as much as you can, even if it's raining, snowing, just getting outside in and of itself is enough. But I've never actually tried light boxes, but I do know back home, I'm not sure if it's the same here in the UK, but they have light boxes in a lot of central libraries where people can come and they all huddle around the back of a library around a light.
Wow. That's clever, isn't it?
Yeah, it is. It's for people who maybe can't afford like the light boxes, you know, and it's almost a community thing as well, because you want to get out and you want to socialise.
Meet people and...
So yeah, it's really good in that way.
How did you get your diagnosis? Because you're absolutely right when you say, as you know, as GPs and certainly busy GP practices, someone's coming, this is something that you probably don't have even enough time to have that conversation with a patient. I would say loads of people or don't even bring that problem to the doctor. Totally, How did you get your diagnosis?
I didn't get a diagnosis as such. The symptoms were just enough to kind of warrant the, I have it. But I remember having it as far back as probably being around 10. Just the anxiety and depression are two sides of the same coin. So I knew the anxiety spike and then the depression, and then I would have had a lot of derealization as well, from the acute anxiety. But for so long I suffered and there was no information. I had no idea. And, a bit of psychoeducation would have went really far with me. But luckily, it's not that way now, and there are more bits of information being out there. But I think it was just coming across at one time because I was so interested in the mind, and I just came across that. I think it was actually in a paper where it was actually spoken about, maybe in the Dairy Journal or something. Yeah. But it really normalised it for me, and it actually made a lot of sense. And sometimes the awareness alone is enough to make you feel empowered.
Yeah,
as well.
Actually, this is a thing, and I'm not just someone who's...
Yeah, you don't feel as ostracised. You feel you can talk about it and be bearable about it. And actually, when you do, people's shoulders drops and actually go, me too, I get the same. So it's actually a really, really good talking point with a lot of people, because it's very comforting then for someone to relate to you on something that you may felt that you were suffering with alone.
I mean, presumably in your workshops and when you meet people and that, this is something that you put out there to say, look, this is a thing, and learn a bit about it.
It's been the busiest workshops, yet that I've done, and because it's so relevant, and because even putting a name to it, beating the winter blues, it's enough for people to go, oh, I feel low in winter. What is this about? I want to go and find out. My approach is very non-clinical, and so I would have me, but then I have a nutritionist in, because we believe food is vital, to your well-being and your mental health and the bacteria in your gut. And not many people know that yet. It's still kind of coming out in research, but if you kind of just empower them to kind of take action, work on the probiotics, work on the kind of inflammatory foods they're taking and cut down on those and the omegas, and it can really change. And I've seen people who have changed their diet and started taking probiotics, and they've been able to do things that they had never been able to do because they were so inflamed in their gut, and it was having a repercussion on their mental health.
It's funny because, we talk about this a lot in these podcasts about what you do during the day having an effect in, obviously on your general well-being, but your ability to sleep and your sleep patterns. Is there... Khaled, is there some sort of magic trick for, in your experience, being able to get us up in the morning and be ready for the day in these dark times?
Well, we used to have Mr. Motivator on television, but we don't have him anymore. Well, sadly, there isn't a magic pill. There's no magic bullet at the moment. There's no medication that will resynchronize your body clocks. I'm sure that it's in the pipeline with the big pharmaceutical companies. They will develop that. But if you look at sleep hygiene as a whole, if you want to feel refreshed in the morning, you've really got to be thinking about what you're doing 1 o'clock the afternoon prior to that.
Okay.
So as Caroline was saying, alcohol, we've got to think about things you consume, things that can disturb your sleep patterns, like caffeine or alcohol, the time you eat. So a lot of people don't realize that caffeine has a very long half-life. So if you have a strong coffee at 3 or 4 in the afternoon, chances are by 3 or 4 o'clock in the morning, you've still got about a quarter of that caffeine still in you. And that's like a lot. Yeah, it's like waking up. in the middle of the night and having half a Starbucks.
Yeah.
And then hoping you're going to feel
Go to
refreshed in the morning. It's not going to happen, exactly. So you've got to think about the sleep hygiene, and that starts from about midday, what you're consuming. You've got to think about your sleep pressure, that momentum that's going to get you to sleep. We're creatures of habits, and we really need to have associations. And one of the bad ones is to think when you get home, you're just going to crash out on the sofa and get a quick nap, recharge. And unfortunately, that kind of gets the body into a habit of thinking, well, we're going to sleep on the sofa, so we'll expend some of those valuable pressure points there. Or we go to bed, and that's where I do my emails and Netflixing on my laptop. And so your brain thinks, okay, that's not where he's going to sleep or she's going to sleep. So you've really got to think about your lifestyle. And I think taking a week diary, sleep diary, plotting out your day, what you're consuming, think about what time you're waking up and what time you're going back to sleep. Think about what time you're having coffee. Think about your exercise regime. Plot your mood as well. And then make changes accordingly. So I tend to go through all of these processes in clinic and try and get people to kind of optimize their sleep hygiene and their sleep behavior to get them back to bed.
I suppose people who have SAD and are kind of getting themselves into a groove in terms of maximizing, the brightness in the day and trying to feel better by all the strategies you have, that all goes fine until Christmas comes. Kids are super excited, parties right, left and centre, eating badly, drinking badly, exercise goes out the window, stress of trying to get everything done. How do you manage? What's your sort of trick? Because you've obviously done the festive season loads of times before with this in the background. What do you do?
I think it is about having boundaries and being unapologetic about those boundaries. And even like, if you don't want to explain why you're not drinking, there's just loads of ways to fake drinking. But I think it's important to kind of really take a lot of time out to introvert, even if it's just like a bath or taking time to read. And I know some mothers out there may be thinking, God, you can tell she has no kids. But I think it's vital in order to kind of have time yourself to reflect and even to kind of stay within your routine as much as possible throughout Christmas. And sometimes, the excess of Christmas is absolutely unnecessary. So it's about cutting back, and not just for health reasons, but for the planet and the environment, and getting your kids involved as well can be really empowering to them. And I think, maybe changing up certain sweets for like nuts and things like that, I believe it could be done, but I think the hardest thing is getting started for a lot of people. The idea of it is so much harder. But if they actually put a plan in place and then get their kids involved as much as possible, then it'll be a wee bit easier, I find.
And I suppose you're right, planning in advance, because if you are that party person who throws everything, caution to the wind for that, because it could be, it starts so early now, like it can be for 3 weeks or 4 weeks. Maybe it's understanding that you're able to not be that person this year, you can be a different person.
Yeah.
And trying to put those boundaries in. How do you feel about that? What are your sort of top tips in terms of getting the kids to sleep and getting yourself to sleep?
I think it's very easy to lose your routine. Especially when there's lots of bank holidays, lots of festivities going on, your usual routine is out of the window. But I think you've got to kind of, like you say, everything in moderation. You've got to think, listen, this is all going to come to an end and I want to come out of it relatively sober. So keeping your routine, making sure that you are sleeping on time, that you're waking up, you're getting the exercise in. We're not spending all day sort of eating and lounging and vegetating in front of the television and Granddad's falling asleep on the chair. We want to get ourselves active, get out, get some sunshine, get some fresh air, go for a Boxing Day walk, and try and just maintain a relative normal routine throughout the festive period. Having said that, obviously Christmas Eve, Christmas Day, for the presents,
tricky.
The kids, you can't
tricky.
Stop them from waking up so early.
But I suppose if you get out of sync, that get back on the bus again, think about your routine and try, and just because you're out of it doesn't mean you can't slip back into it. I think of the sort of top tips, your tip about boundaries, I think is a really good one. And because in Christmas, most people have no boundaries. So it's maybe thinking about, boundaries generically. And routine, maintaining that routine. And on the broader subject of seasonal affective disorder, awareness is really the key, isn't it? And I think that's awareness for us as doctors, and thinking, actually, you know what, this person, this is real. This isn't some, I hate the winter. This is this is a diagnosis, and we need to treat this seriously. Yeah. And for you, doing as you're doing, spreading the word and getting information out to people is vitally important. Yeah. It's been really interesting. It's very interesting to hear from your side, because obviously if you're living it and you've got the science behind, it's very interesting. Thank you so much. It's been an absolute pleasure. Thank you for watching the Sleep Matters podcast from Dreams. If you enjoyed it, then please press the like button below. And if you want to see more, then you can subscribe to this series.